Now, there has been more reaction to the treatment of Rahima Musa Mother and Child Hospital Dr. Tim de Maayer after he blew the whistle on the conditions at the hospital. It's now emerged that Dr. de Maayer has been told he will go through a disciplinary process and receive a written warning. Now, the South African Medical Association has accused the Gauteng Department of Health of withholding information on the alleged disciplinary hearing against the pediatrician. Joining us now from the association is Dr. Zanele Bikitsha. A very good evening to you. Thank you so much for your time, Doctor. Public outcry and pressure from medical entities eventually resulted in Dr. de Maayer's suspension being lifted, but the matter is seemingly far from over. A disciplinary process is underway. What do you know about it?
Hi, yes. Firstly, it is sad that it even needed to get to the level of a public outcry, for something to be done. I do know that, it creates a certain public perception that if you dare speak out against, the current work conditions and let's say the problems that are inherent within the public health sector, you are then going to be victimized. So that's the perception that it is putting out there in the public. We did come out as SAMA in support for our colleague to say that, no, we cannot accept this. And we were glad when we heard that the MEC, heard all the discord and then took it upon themselves to have a meeting with the management of Rahima. So that did happen. The suspension was withdrawn, but it then comes, as a surprise that it's not an unconditional withdrawal, of the suspension, and that certain internal processes are apparently still going to happen. To date, we have not yet seen, any letter officially written to him regarding this. But yeah, so that's where we are with regards to that. But we are calling as a South African Medical Association for the unconditional withdrawal of that suspension, including any processes against him, because we think that this is really, it's unnecessary, it's overreaching. Not only does it violate his labor rights, I mean, if we're going to go into labor law, there are certain processes that do need to be followed when it comes to disciplinary processes and all of that. But it also then raises to question that this was just an employee raising frustrations. And if you read that open letter, it was global frustrations. It was not targeting the hospital management. In particular, it was speaking to the deficits that are within the public health system, which we all know, we all are aware of, and we've experienced once and again when we've got crises. And, knowing that these have been raised, I mean, there were letters written to management in 2006, I think it was, if not 16. Again, there was another one written last year in April, trying to get the situation within his nursery particularly sorted out, and which was not done. So instead of us looking at this open letter as an opportunity to look and say, look, how can we fix the system and what can we do to make sure that we are doing the best for our patients, this then became the response, which we are seriously as an organization saying that it is uncalled for and we won't stand for it. And we do expect that this becomes an unconditional withdrawal of any sort of action against Dr. Tim, but not only against Dr. Tim, but also against other employees who then have, the good nature to come out and say, look, there's a problem.
Mm-hmm. So how do you say that you haven't seen the disciplinary letter? How do you know that that process is indeed something that will be happening? Because the Gauteng Health Department had stepped in to say that they've amicably resolved the matter and it's now closed. There seems to be some contradictions of this matter.
Yes, well, that's why I'm saying I just want to be clear that we have not seen anything yet in writing. This was in communication, with the doctor and people on the ground after the MEC had been there. So it does seem that at a hospital level, this matter has not necessarily been put to bed in the manner that we'd have expected. But like I said, just to be fair, we have not seen anything yet in writing. But we will remain in touch with Dr. Maayer so that should anything happen, we're able to quickly and sharply raise it, because we're not going to stand for victimization of people that are just calling for, good working environments so that they can do the best for their patients and provide good service.
So you're saying that you do acknowledge what the Gauteng Health Department has said, that they've stepped in and this matter is now closed, but it's now on an employee-to-employer matter where the two are coming together to, chart a way forward or not.
Yeah, that's where it seems to be, the problem seems to be rising from. But like I said, let me rather say, we have not yet received anything in writing, but that is what we've been told to put at a hospital level. We are, though, also asking that this be investigated. I mean, how did it get to that level? We do need the CEO to be held to account. How did it get to the level where an employee is publicly shamed like this and suspended? I don't think this is how we should be treating professionals. I think that does need to be looked into.
And what were the conditions that were attached to the reinstatement after the suspension was lifted?
Well, if you do know, obviously those would have been in confidence, but, it obviously would have been in general about, public commenting and all of that. But that's why I'm saying we're now caught in a situation where we don't understand, because you've expected that there's an intervention from a MEC level. You would not think that there would be any further repercussions after that. So, accusations about putting the department into disrepute and all of that, which I don't think was the aim of Dr. Maayer's public letter. I think he was just highlighting his frustrations and also highlighting the shortfalls that are within the public sector.
Yes, because what this was all about, in essence, was him being brave and giving some form of exposure to what's happening inside the hospital for awareness and something to be done about it. Do you believe that CEO Dr. Newzroom will be fair and objective in this process?
Look, we are disappointed in the manner that it came out in the first place. We don't think that as the CEO she handled it correctly. We will be watching very keenly as SAMA, in conjunction with supporting Dr. Maayer, to make sure that the manner that this is handled is in keeping with fair labor practice, but also, one in keeping with professional ethics. So we are going to be trusting that this is handled in the manner that would be befitting. But we honestly still are not satisfied, and we need to understand that how did it result in just a summary dismissal of an employee? And you need to understand, this is one of only about 10 of his speciality, in the province. What are you saying when you are so, fast to just let go of somebody who's pointing out that these are the roadblocks to be giving you an effective service? And you literally only have about 10 of these in the province. What are you saying about your understanding of the broader service provision within the province as well?
Talking about the broader service provision within the province, do you think that this is perhaps why we're seeing more and more health professionals leaving the public sector to go to private, or some others are also leaving the country?
Yeah, well, look, the issue about doctors immigrating, it is complex. You do have the workplace issues that we need to look at about, do we have tools of the trade? Are the working environments conducive in terms of how many patients do you see, while you're busy, working, in terms of norms? Because there's international norms about how many patients you should be seeing to be safe and effective. You've got working hours. All those do make an impact. You then have salary scales as well that you need to look at, that also determine whether somebody is happy within the public service or not. We do know as well that because of the economic situation, Treasury is only able to afford to hire a certain amount of professionals, especially when it comes into specialities and things like that, and the higher grade MO scale. So all of that does come into play, because if you are not happy, if you don't have the tools of trade, you will be looking elsewhere. But like I'm saying, it's multifactorial. You also need to look at South Africa in the broader context as well, with everything that we've gone through as a country. You're looking to say, is this where, I'm going to get the best education and things like that for my child. So it's not only within those frustrations, but you need to take it in the broader context. Yeah. But we are saying as SAMA that something does need to be done, because at the end of the day, you will not have a health sector if you are unable to retain your professionals within the public health sector. And especially now going towards NHI, that becomes more critical than ever. We need to find a way to resolve what is causing this attrition of our employees. I mean, we're sitting right now, we are in COVID, or we've just come out of COVID. Nobody has said anything about the fact that the health sector did not receive wage increment. Nobody said anything about that. Nobody said anything about the fact that they were asked to come out and did not receive danger pay. Now, those are the sort of things that we do need to look at and say, what are we doing to retain our employees in the workplace? What are we doing to make it fruitful for them to be there? Specializing, we need to start creating specialists if we want to be able to absorb the population in NHI. Are we doing that? Are we creating enough posts to be able to get specialists? So there's a bunch of things that we do need to look at to actually resolve this attrition, or what we call brain drain.
Absolutely. Thank you so much for weighing in on this discussion, Dr. Zanele Bikitsha, speaking there, reacting as the South African Medical Association, calling for the withdrawal of the disciplinary action against Dr. Tim Maayer.